a degree in 2010 back home. Came to Australia in 2012 to study English with a very low English level. Took me 3 years to understand what I was saying, what I was going to do, what if I wanted to stay in Australia in the first place. When I figured out all this and started to take the test, realized that I was completely lost on the way. It was quite difficult for me to understand from the beginning where to begin with, what sort of test to do first, whether IELTS or OET was better. And once I passed all the tests, I thought, well, this is done, all I have to do is to find a job. And that was actually very, very hard. So from my perspective, I think just knowing what you are going to do will make you feel more confident in what you're doing, and that's why I'm here, to try to guide you a bit. So to begin with, I would like to know a bit of your backgrounds. I understand most of you are health related, so are there any dentists here? What? Good. Nurses? Occupational therapist? No. Pharmacist? Good. What am I missing? Doctors?
Yes.
Great. For you, it's gonna be, I wanna have lots more information. For all the other, I'll try to do like a general idea because the process is very, very similar, but I have the majority of my knowledge is in medicine, so hopefully for all of you it's gonna be better. So to begin with, I would like to say, you need to know what you really wanna do. We're all have an international background, so we need to say, where are we now? Am I an international student, or am I an international professional that want to work in Australia? Then, what do you want to do? Do you want to do a PhD? Do you want to do a master's degree? Do you want to start working in Australia? Then, whatever you are, whatever you want to do, you need to make a plan. There is no point in saying, oh, I haven't got this, or haven't got that, I haven't been in the position that I want to be, if you don't know where you want to be. So you need to be clear with yourself. What are your expectations? What sort of resources you have? And with all of those, work together and see where do you want to be and work on it. So at the beginning, very simple. Things like your English proficiency. It's very, very hard to go through all this if your English is like what my English was when I came in. So whether with David or all the background that it was talked to you already earlier, take those pieces of advice because they're very, very valuable. That will make you get to your goal faster. Check your background. Do you have family here? Do you have friends here? Do you have a hobby? Do you meet friends around? Whatever you have will help you if you know how to use it. Make sure that you have every person that you met say, hi, my name is Marizabel, I am a doctor. I'm here making coffee, but just if you know a doctor, whatever. That sort of things will make you get to the point that you want to be in the future. Again, make sure that you don't run out of your visa or you don't run out of money while you're doing this. Might sound simple, but while you are in between all this stuff, living in a different country, with family issues, with issues at school, you need to make sure that every single aspect in your life that's not related to the job is also sorted out. Because if you want to be a nurse, but you don't have money to eat, you will never get to the point of working in a hospital. So, again, as I told you, what do you want to do? Do you want to start a health career? Do you want to continue further studies? With those, the first two things, it's something that I didn't do in Australia, so I might not be the best person to guide you. If you want to get into the field, that's what I did, and that's what I'm here to try to guide. So, the things that I told you, all health professionals go through the similar stuff. First is the council. We have the pharmacist council, occupational therapist councils, nurses council, all of them do the same thing. What they do is to assess whether you are a nurse, a doctor, a dentist, that you actually got your degree in whatever your country is, and that degree is similar to the one that they get in Australia. Most of the professions will go through 3 similar steps. The first will be some paperwork. You will have to send your degree, your passport copy, and that sort of things. In most cases, they will contact your country and check, yep, this is Marizabel, yep, she's studying in Venezuela. After that, you will have to take tests. depending on your profession. I know pharmacy is only one test. For nurses, I'm not too sure. For doctors, there are 2 tests. For dentists, it's also 2 tests. Written one or a paper-based one, and a clinical one or practical one. But all this information, I'm going to go further on the presentation. Then, once you convince the council that you are a health professional in your country, you need to convince the board that you're safe to work. This is 2 different things, one thing to the other. The board will say, yeah, you are a doctor, a nurse, whatever in your country, but are you safe for us to give you a job in Australia? And that will check, is your English good enough to be working in a hospital, in a pharmacy, or wherever you're going to? Do you have any criminal background? Are we going to let you go there? So for some professions, you will need to prove your English with the council, with the board, and then with the job. That's why this solves these problems where you need OIT. Is it 2 years for them? Is it 2 years and a half for them? Is it 1 year for them? So you need to check all 3 stages to see what are the things that you as a person need and make sure you're qualified with all of them. One of the mistakes that I made is that as soon as I get to Australia, I said, all right, first step, English, because I need to know English to do all the tests. Problem is, I arrived in 2012 and I'm working now in 2015. That was 3 years. My English for that time would have expired by this time. So you need to make sure you follow through a plan and all the tests that you're going to take are also in the perfect timing. I believe OIT, IELTS, or whatever the English test is, the minimum they ask is for 2 years. I'm not too sure. Again, check with your council, check with your board, check with your jobs. I've made a list that is not too easy to follow, but if you're interested, they can send you all this. So for all the professions, with the website of the council first, the website that is there is going to take you straight to the overseas professional assessment, because the websites have usually lots of information, so this is going to guide you, go straight to where we want to be. Then the second one is AFRA or your registration. Then again, it's related, as you can see, well, probably you cannot see, but it's dental board, physiotherapy board, pharmacy board, and so on. So, first thing that you need to do as a doctor, sorry for everybody else, I hope it's pretty much the same, is get with the council. So with the council, as I told you before, you have 3 steps. Step 1, get registered. Get registered, go to this website, apply online, and from there, it will take you each step. If any of you have a problem going through the step, I'm going to leave you my email at the end. More than happy to guide you through. I have a guide already in Spanish, so if you don't speak Spanish, more than happy to guide you in English. Then, second step, doing an MCQ test. An MCQ test was, for me, not too easy, at the same time, not too difficult. Why? I'm quite young, I've been studying last 17 years of my life, so studying a bit more was not a problem. The problem was getting used to the way the questions are written in Australia. In this test in particular, it's very easy. STEM, 5 options, choose one, you win. So you have roughly 20% of chances of getting the right answer. The thing is, the STEM was like this one, and it told me the entire story of the family to say, how old is the guy? I'm like, what the hell? So if you actually get familiar with the system, get familiar with how the questions are written, it will make your life lots more easier. The general information of the test is there is 150 questions, only 120 are assessed, and these are all the general topics that are assessed there. It is very important to see that they actually have 15 of obs and gynae, which is women's health, 15 questions of pediatrics, of child health, and at the same time, 15 questions of mental health, and 15 questions of population health, which for me, it makes no sense whatsoever. But that's the way the Australian system is created. That's the way the Australian system actually works. It is as important children's health or women's health to population health or mental health. So there is no point in a study the way that I used to study back home, to focusing on general medicine, general surgery, and the big topics, if you are not covering at the same time things like population health and how to treat people who have dementia in their living in their home. That's all. One, because this test, you have two options before you start working. You can either clear a clinical exam and find a job or a job offer in a hospital, or you can clear a best exam and find a job as general practice. These two tests are very, very different in between each other. I'm going to try to explain a bit about it. The clinical exam, it's a role play sort of game. You will get into a room with an actor who's going to pretend that is your patient. Sometimes it's an actor, other times it's a medical student. And there's there an examiner who is not going to get any input on your test, but is just trying to listen and assess from your body language to the tone you're speaking to the patient. So it's very, very tricky because it's not whatsoever about medical knowledge. It's about your interaction as a health professional with the patient. These tests have roughly a pass rate of 30%. That is very, very low to be that expensive. So I will highly suggest practice, practice, practice. When I said practice, I mean grab your neighbors, grab your family members, grab your co-workers, whoever you know to, give them a case and try to explain what you're trying to say. For this test in particular, my preparation for OET was very, very useful because on the OET speaking part, you actually have to interact in a role play sort of game. So that will help you with this. My suggestion, again, personal one, I will say take time to prepare. It's again a very expensive test. I think next year is going to be 3,500 or something like that. So unless you feel you actually prepare, don't go crazy and pay for this.
So how long time would you say like is enough or is the minimum?
That's again tricky questions, and I hate those sort of answers that it depends on you, but it really does depend on you because
like how long it take for you?
For me, it took 6 months, but I took it twice. I got the first time I prepared for 3 months and I studied very, very hard, and I didn't pass, but I didn't fail. I got a retest. That means that you got, I think it's a 11 out of 16, in between A?
Between 10 and, 10 or 11.
10 or 11.
Yeah.
If you get 10 or 11 out of 16, including one of children's health and one of women's health, you don't fail, but you don't pass. You get the opportunity to take a retest. A retest is half of the test. And instead of 16 stations, you're going to go to 8 stations.
And you have to pay again for the test?
And you have to pay half the test because it's half of the test. So in theory, they're trying to say that, yeah, we gave you an opportunity, you were good, but not quite good enough. But you weren't that bad to say you're not prepared to work in Australia. So they give you this opportunity that you can have half a test, you need to pass half the stations, and you can pay half the money. So I studied 3 months to get the test once, got the retest, studied another 3 months, got the retest, and passed. That's my personal experience. It depends a lot on what you're doing. It took me from MCQ to OET roughly 8 months, I would say, and I've been studying pretty much full time. So it depends on how much time you have for to study. It depends on how much support you have, because if you're alone in Australia, you have to work to survive. So it won't mean that you will have that much time that I have. It's, if you finish med school 15 years ago, it will take you a lot longer than what it took to me. I had friends that studied in 3 months and cleared the entire test. I have friends that studied an entire year and then had the opportunity to clear the test. So it will depend on how familiar you are with the system and how much opportunity you have to practice with someone who knows how to play the role with you. I don't know if that answers the question.
Yeah, it does, thank you.
Then, as I told you, very different test. Clinical Troublesome if you're trying to find a hospital-based position. Pesky is if you're trying to find a general practice-based position. It is not a role play anymore. This is a discussion, and you're gonna be assessed to the same point of the general practice in Australia. General practice in Australia is one of the highest level of health professionals because they are in the front line of the health system. They see from the basic stuff like the flu and cold to real emergencies of people who doesn't get to hospital but they go to the family practice, the general practice. So you have to have a very wide set of skills to pass this test. At the same time, it's not a role play, but rather an interview with a set of exams. So depending on the job, from the beginning, in order to take this test, you already need to have a job offer. And that's the tricky part. You need to pass MCQ and your English test. Find a job that's gonna give you an offer in order for you to apply to be able to get the opportunity to sit this test. That's why, even though most people say it's easier because it's not an acting, it's actually a discussion, it's not that easy because you need a job offer. And that's, from my perspective, one of the most difficult parts of the entire process. If you get the job offer, congratulations, go for the pesky. It's going to be 5 clinical scenarios based on the job that you're going to do. And that's why you need the job offer. Because it's not the same, there are not the same sort of pathologies that a GP in this middle of Melbourne is going to see compared to someone who is working next to my hospital in Ballarat. So they kind of see what sort of conditions are frequent for your area and for the type of job that you're going to do. And then there is no fail or pass score. They will say, yep, Marizabel is a doctor, she's going to need supervision on every single case. Or, yep, she's a good doctor, she can go and work on her own as long as there's someone on call. Depending on the level of supervision they think you have, and these sort of things need to match with the level of supervision that your employment is going to offer you. Sounds tricky, but it's all in there. Then, the difficult part, as I think, is finding the job. And again, I'm trying to explain in 3 different parts. First is to write your CV. It is a very important skill that you have to learn. A CV is the first thing that your future employer is going to read from you. They have to really say in a piece of paper where you are, what you have done, and what you're capable of doing. Then you have to start working, looking for a job. And again, it's not just you're going to go to every single practice or every single hospital knocking the door. You actually have to have a system and know where to go. And then once you finally get the offer of employment, and if you need it, you clear pesky, it is when it comes to registration with APRA. So, dividing each part, the CV needs to be an APRA style. With APRA style meaning Australian style. APRA actually have on their website model how to follow it. It is very good to follow it, and at the same time you're gonna just fill in the blanks because every employer will notice that you're just copying whatever it is on the website. So it is important to see what sort of position you're applying to. Is it a GP position? Is it an emergency-based position? Is it a HMO that I'm going to be in between every different area of the hospital? I cannot say the same. Yeah, I am good at gene asthma, and then the position is for gynecology. It's just not gonna make sense. So you need to describe what sort of job you have done. If you did just general-based practice, don't write I did general-based practice. Look up that name, how the people in Australia say that is, and use it in your favor. If it is general practice, write general practice. If you were rotating in between a hospital, you are not a resident in the hospital. You are a hospital medical officer. It's not the same name that you had in Spanish or in Portuguese, but it is the same that people in Australia will recognize it. So if you make it easier for the recruiter and you speak the same language, it will be a lot easier for them to actually say, oh yeah, I understand what she did. She was a hospital medical officer, because that's the same thing that we do here. If you think this is, also explain your professional gaps. For me, it took me 3 years from the last time that I worked to the first time that I worked here. And I cannot say, yeah, I arrived to Australia in 2012. And what have you done? I studied English. People will say, what the hell are you doing? You're supposed to be a health professional. What happened all these 3 years? You're losing skills. And a health professional, that is actually dangerous. So what I've done, I got familiar with the health system, I improved my English, I volunteered in aged care area, or you did a pathology lab course. Whatever you did, use it in your advantage. Don't just say, I came to Australia. Try to explain and make them know that you were not just looking around doing nothing in Australia. You were actually using this time to get more prepared, to make it easier for you and safer for your future patients to work. There is a lot of information that you have to do in 2 or 3 pages. I would highly suggest, if you think this is too complicated, you don't know how to do it, get professional advice. I'm not a professional advice, there are people who does it. But it is the best thing, because once you are not there most of the time, hand it in your CV. People are going to judge your entire career and all the things that you have done with a piece of paper. If that piece of paper does not represent who you really are, people might say, no, I don't understand, and throw it away. And in some cases, you're actually the right person for that job. So it's very, very, very important that you highlight in your CV the areas of skills that you want them to see from you. Then, job hunting. That was, from my entire 3 years, the hardest part by far, because no one ever tells you where to go. So that's why I highly encourage you to tell everybody, even the people that if you are a cleaner and you're cleaning an office, say, yeah, I'm a cleaner, but I'm also a nurse, just for you to know. You never know who the people around you are going to say. It's going to say, yeah, you know what, I actually know someone who has a GP practice, they need a nurse. Why don't you come around and talk to them? It might be nothing. It might be your next job opportunity, and you need to take it from there. That's why I highlight networking. That was one of the words that I hated the most when I came to Australia. I thought, this is ridiculous. It's not because someone knows me they're going to give me a job. And that happens a lot. It didn't happen to me, but it has happened to, I will say, most of the people that I've known around, most of the people that are working in my hospital. It's very, very important that you get your name around, that people know that you're a doctor, nurse, or a dentist, working making coffee, but working on being again a doctor, a nurse, or a dentist. Next step, going online. Again, another stuff that was difficult for me, because back home I would go to a hospital and hand in my CV, say hello to someone, and then call them the day after. Here, it's very unlikely that from that way you're going to get a job, because you cannot just go to every hospital in Australia. You have a huge country, and most of the cases, all the recruitment process is done online. So I'm not too sure if you can actually read this, but these are the websites that I got mainly from Victoria. There are a couple from interstate. What I've done is literally Google list of hospital in Melbourne, and then went through each hospital, finding out how they recruit people. For some of them, they actually send me, go to the website. Another, they said they had email contact or something. I know that it works the same thing for dentists and for nurses. I'm not sure for the rest of the health profession, but I think it's worth taking the time to actually go to the websites and see how do the people look for a job. If you ever met someone who has your same background, actually ask them, are you working as a pharmacist? What did you do to get there? What do normal people in Australia, with an Australian background, do to get there? And try to copy all the system. Again, direct approach, going to the practices, going to the hospitals. It is quite difficult, but from some people hard work. So I will say, try all of the options from them, because you never know where you're going to have a job. This is the part, again, most difficult for me, because everybody keeps saying, oh, but you can get a visa if you're a doctor. You can get permanent residence if you're a doctor. All you need to do is to find a job. And there's so many jobs around. Not true. There's so many jobs around for people from Canada, Ireland, New Zealand, with a similar background. When people say Venezuela, it's like, that's in, I don't know, third world country, maybe they don't even have band-aids, which is quite true, but I wouldn't trust in her, so nah. So it's going through the direct approach kind of thing helps a lot, because you actually get the opportunity to say, hey, yeah, that's me. You can ask me some questions. I am very approachable. I don't have a bad English. So it gives you a bit of a push. So it is difficult to find a job that way, but it'll give you a bit of confidence on what your level is, and it gives you a free practice on how an interview may go. If you go to the practice in your next door, you know that they're not offering jobs, but you're actually going to talk to someone about your professional, your background, your profession, and what you do. And that practice that you just did meeting someone will help you when the time comes to do the real interview. So if you have the opportunity, you give it go. Once you get the job offer, it's the easy part upfront, believe it or not. Because for all the other health professionals, I think, I'm not too sure if all of them, but most of them, you can actually get registration without a job offer. Doctors, we cannot. We need a job offer to get registration. And that's why it's difficult. We have three different types of registration. First one is the limited registration. That means we have to do MCQ test, which is the first test with ANC. The English test, OET or IELTS, I will highly suggest OET. That's the one I took. The offer of employment, and depending on the offer that you have, if you're in a hospital base, that's it. If you're in a GP practice, you also need the best one. So it's a lot of things that you need to do before then thinking about registration. So that's why I always highlight, you need to make a plan, you need to know what you want, and you need to work on it. Yeah.
I have a question here. Imagine that I get a hospital now, and then I get the registration or whatever, and eventually I want to go to the general practice. Should I still come back to do the PhD?
It depends on whether, to work in a general practice, you can work just with the knowledge that we, all the doctor have, or you can work after you have done the GP training. To do the GP training, there is a long process of, I think, the minimum 6 years, and that will involve working in a hospital and in a GP practice as well on this operation. So it will depend on what you're exactly doing to say if you actually need the PESCI, yeah, yes or no. If you already work in a hospital, you might qualify already to get general registration. So you might skip a couple of steps, but it depends on what you've done. It depends on your experience back home. It depends on how many years you have worked in Australia. Most of the time, it will be yes, you will need a PESCI, but that depends on your experience. Alright, so that was limited registration. Provisional registration, you will need the ANC certificate, which means passing MCQ and clinical, plus the English test, plus, again, the offer of employment, and depending on the offer of employment that you have, if it's a hospital base, that's it. If it's a GP practice, you also need, again, PESCI. Finally, to get the general registration, all you need to do is the ANC certificate, MCQ and clinical, plus 1 year supervised practice. And that's where the tricky points start, because that's it. If there's someone here trying to get permanent residency through medicine, you need to get this first. So you need to do ANC, MCQ and clinical, your English test, find a job. If it is a GP job, based job, you need to do the PESCI as well. Work at least for a year, depending on the type of job. Upfront might ask you to do different rotations in between. You need, in theory, at least 10 weeks of medical practice. 10 weeks of surgical practice and 8 weeks of emergency practice in this year to be qualified for general registration. And I said in theory because that changes a lot. If you have, I've seen people working in a GP practice who in their year they see emergencies like attending an asthma attack, and surgical cases like doing some structural stitching, and abstract counting the entire experience of medical surgery and emergency there. So if you have a hospital-based position, it's pretty easy because in the hospital you are going to go through all this area. If you have a general practice position, you need to be very, very careful to make sure that you do qualify with APRA with all the things that they want you to do. My advice on the first meeting that you have with APRA just before you get the registration is ask them, look, this is my first meeting. Next year, I want to get general registration. What do I need to do? So by the time that year comes, you already knew what to do and you have done it. It's very sad. I've seen people that actually take 3 years or 4 years to get general registration just because they didn't know what to do. And they work 1 year in general practice, actually doing things that were qualified as medical or surgical or emergency, but because it's not written on the paperwork, they cannot get general registration. So as soon as that you get to know what you need to do, work on it. I think that's it.
If you have any question?
Yeah.
Sorry, in fact, thank you for this detail.
It's a lot of information. And I
Yeah,
speak
yeah.
very quickly, so that's alright.
On one hand, that is very nice. On the other hand, difficult to collect all this.
It's too much,
So
I know.
if we can get some copy of.
Yeah, that's
Video
absolutely. What I'm
would
going
be
to do
great.
is just, I have my details there, somewhere. Email. Be free to get my email, and I'll send you the presentation and
Yes,
answer.
yes, please.
That's what I said with
That would be very helpful.
anybody who is from another health profession. I told you I haven't done nursery or dentist, but I'm more than happy to help you guide you through the